Thank you everyone for joining us this morning or this afternoon, this morning, wherever you are, evening time, wherever you are around the world. Today's webinar, we're covering iridology seen through the DNA code of amino acids. Vital Life Energy Formers does not treat, diagnose, cure, or profess any cure of any sort of disease. And Jeff is going to now start. Thank you.
Yeah, we want to express that I was very fortunate to come in contact with Dr. Brian Jensen and his understanding of genetic iridology. Dr. Jensen first learned the iridology back in the 30s in Walnut Creek, California, from a naturopath. And Dr. Jensen is very famous here in the United States for iridology and all the different charts and books that he's written. Dr. Jensen originally started out with embryonic iridology, which starts with the DNA code of the life force in the body. Now, in that process, it goes with the DNA of the actual embryo. And the embryo itself is the actual center of the body at the time of conception. And being a chiropractor, he could see in the embryo the actual spine of each fiber in the eye that actually went directly to the production of the actual energy of the child and the embryo being formed. At the same time, in looking at the embryonic chart and his understanding of it and his teaching of it, it was confusing to people. You can see this is the chart that Dr. Jensen originally put together, and it deals directly with the way that we look at genetic iridology and how we see it from inside out, from the actual life force and the formation of the spine of each vertebrae. In other words, each vertebrae exact fiber of the spine from the top of the head to the sacrum and the bottom. And of course, the embryo, the center of the eye is the actual umbilicus, and it goes around from top to bottom. And that's how we see it. And over many, many years of Lorraine actually utilizing this understanding, we're able to actually pick up our genetic strengths and genetic weaknesses from each fiber, and from 1 month to another month to another month, we can see the actual changes. So I wanted actually you to see the history of it and how we've actually come to the point of genetic iridology and understanding the DNA code, because the DNA is actually the relationship of the amino acids, which actually form the body and form all the organs, all the muscle, the tendons, the brain, and so on. So this is the actual understanding of the genetic iridology and how we've been teaching it, and how Lorraine's been able to show you over all these years, with her changes and like that, which is absolutely phenomenal what she's able to do. I also met Dr. Jensen back in Florida. Before that, I was actually in Long Beach, California. There was a talk that I gave on polarity therapy. And there's like 10,000 people there. This is before you had distancing and people couldn't gather in a space, which is pretty the way it is today, but pretty ridiculous, but that's my opinion. So anyway, so the situation there is that he heard me talk about polarity therapy and my understanding of Dr. Stone and how polarity therapy deals with the direct relationship to the life force of the energy moves through the body, which is what we're seeing in the genetic makeup of the eye. Now, what you see actually behind us right here is Dr. Jensen's master chart. And from that master chart comes to the actual, that's what's behind us, and that's his chart. But he then came to the people would not learn the embryonic iridology. And so what happened was that when I was actually teaching about polarity therapy, he heard me and he came off, he was coming on, not the next person he was going to come on. And he said to me, he says, Jeff, you have this incredible understanding of Dr. Stone and his teaching, and you need to utilize that teaching in relationship to iridology. And that was actually the beginning of the understanding of us utilizing iridology in relationship to everything that we do with polarity therapy. And when you look at the eye and look at the life force of the eye, because as we know, the light comes into the eye and that actually positions us on the earth to where we are, whether we're in Australia, England, California, or wherever. The actual position of the sun to the earth is the polarity, is the energy that we're actually working with and dealing with. So that light that goes in here goes directly into the eye, which is the actual beginning of the conception of the sperm and the egg, which is directly related to the nucleus. When you look at the chart that we're showing here, it's showing the very life force of the body, and the mind is the top part, up here to the hypothalamus, to the pituitary, to the thyroid, to the thymus, to the adrenals, and to the ovaries and testes. That life force moves from the brain, moves down to the genital, but we start from the bottom, move back up with our vital energy coming from the sperm and the egg, and that's our vital energy that we store that we actually can see in each fiber of the eye. And that changes literally from 28 days to 28 days to 28 days to the level of what stresses we're dealing with. And it has a direct relationship to each vertebrae, which Dr. Jensen was a chiropractor. So he could see that each vertebrae was actually a direct duplicate of the fiber of the eye. And so then he designed the chart that we see behind us, because that chart is the one that's normally utilized by people because it's parts. It's not dealing with the life energy, the life force, or the vitality of the individual. One thing that Lorraine's able to do and pick up in the eye, and actually shows all of you, is that the lightness of the eye in relationship to the absorption of oxygen. That lightness of the eye is actually the healing of removing the bacteria out, and the underlying cause of whatever the problems from the past start to show up. So you can have a very light, kind of bacteria kind of forming, or very white, and then the oxygen levels come in and the blue starts coming in behind the eye, in a blue eye, and then that clears the bacteria off. And now our immune cells, our T cells, can actually recognize it. And now we can see some yellows coming up in the blue eye, and that's showing the excess estrogen, which Lorraine will point out to you. At the same time, that the bacteria, the carbon dioxide has moved off, so we can now, and the immune cells can now recognize it and release the T cells or stem cells, or activate red blood cells or white blood cells that the body actually needs in order to go deeper to remove that excess estrogen out. And the actual umbilicus here in the center of the nucleus of the eye comes from the umbilicus, the center, and spirals out to the outer part of the eye. Now, the other chart that we have here, which when we sent you.
The nucleus we sent as well.
Okay. So you can see the yeah. So we're it's okay.
Oops, sorry.
No, we're getting them all there.
Just so that everyone understands, with the actual iris, it's the last part to be formed of the first 12 weeks of conception. So once the sperm penetrates the egg and the sperm and the egg connect, the pulsation of the sperm and the egg is what weaves each of the vertebrae, the bone marrow, each of the nerves, spiraling from below all the way up to the top of the head. It's the pulsation of the sperm and the egg that weaves each of the bones, the vertebrae, and the nervous system. The last part of the first 12 weeks, the brain is formed, and then the eye is the last part of the brain to be developed. So that's the reason we can pick up through the fibers in the eye certain genetic strengths or weaknesses, because we're seeing that first 12 weeks of when the sperm and the egg connects and forms those nerves and the vertebrae to the brain, and being your eye the last part to be developed. So then from that, we see, because our DNA are amino acids, so certain markings in the eye will show certain amino acid deficiencies because of the fibers showing whether it's hereditary or it's environmental or it's some sort of stress or trauma. And then we use the amino acids to work on the genetic inherited weaknesses so they regenerate, because when we're under stress or exposed to chemical or a virus or mold or fungus or bacteria, it will settle in the weakest areas first. It does not go to the strong areas. It will always go to our weakest area.
So when you see in the chart that Workplane's going to bring up, one of the things you see in that chart, that's good, perfect. There we go. So what we see is the outer part of the eye is the bone marrow, and the bone marrow is where the body actually is where the immune system starts. So T cells, stem cells, white blood cells, and red blood cells are manufactured in the bone marrow, which is the outer part of the eye, is what it activates from the center core, from the umbilicus, moves out to the earth, which is the bone marrow, and in the earth is what we activate all our immune cells. So we need the earth from the light of the sun, which is the brain from the sun itself, moving down into the earth itself. And that earth plane, that prana, that life energy, the male-female energy comes together, as Lorraine explained, at the time of conception, and then moves directly up and spirals and starts forming the whole, the embryo in us. And then at the end of the 12th week, the iris is actually fully developed, and that shows each fiber genetically, again, the genes or the amino acids. So we can see the genetic strengths that we were born with and also the weaknesses. And then from the actual formation within the womb in that 9 months period of time, whatever the mother's going through, is going to also show up in the eye at the time of birth. And that's the situation there. So this chart actually shows that. It also shows a center line through which is this cerebrospinal fluid moving up to the top of the head, okay, all the way down to the sacrum. The sacrum pumps, as you've explained before, it pumps like a dolphin and spirals it up, and that's showing the spiraling. It goes directly up the top of the head. Now, again, when the baby's born, that fontanelle is actually opened up. And so that life force, the soul energy is not totally in the physical body until that closes down. And then when that closes down, then the soul energy goes into the core. And then from there, the life energy is moving through the bone marrow, from the umbilicus and core out on a daily basis, spiraling out just like that, which shows in the Dr. Stone chart with the vital life force.
So we teach inside out, outside in. Top of the eye to the head, across the middle. Anytime you see somebody's eye and you see anything across the middle of the eye, it's the center of the body. And anything lower half is lower half of the body. So it's that part's actually very simple. And if any of you had foot reflexology, it does map exactly the same. But we also teach inside out and also outside in, which is the reason Jeff's explaining about the outer circumference of the eye being our bone marrow. In the iris charts, it's also the skin. The outer rim of the eye is the skin. We have more calcium in our skin than our bones because our skin sheds like a snake. Every 3 to 4 days, we have a new skin layer. So we have more minerals, specifically calcium, in the skin than our bones. It's the reason we look from inside out. And when you go to the middle of around the pupil, which the pupil is the optic nerve in the back of the brain to the eye, which we see from the back of the brain, but it also is the umbilicus, which is the beginning of life. Once our mother's blood's connected, which is after the 12th week, through the placenta and the umbilicus. So right round the pupil goes the digestive zone. So understanding the digestive hub around the pupil, stomach, small intestine, down the insides of the eye, insides of the body, on the outside of the eye, outside of the body. Again, simple. So anything straight down the center of the eye would be close to the pupil, being the digestive hub around the pupil, is the small intestine. Anything on the outside of the eye, depending on what eye you're looking at, depending on the outside of the eye, then that's the large intestine. Right eye, right side, left eye, left side. Now, our optic nerve will cross over in the brain, but not with our eyes. The right eye, right side, left eye, left side. So also understanding the inside being the digestive zone, which when you see healing in the digestive hub, then every organ begins to show improvement. Because that's where the nutrients are being broken down, first through the saliva in the mouth, but broken down in the stomach, liquefied, emulsified, and the nutrients being absorbed directly into the bloodstream at the beginning of the small intestine. And then that's the reason we look at it outside in inside out?
So, as you know, we've been doing iridology for 25 plus years, and Lorraine's been utilizing this understanding all that time. The history goes back to originally with Lynn, my wife, where she had met with Dr. Christopher. This is back in the 70s, so we're going from the 70s to 220 today. So we're back in the 70s, Dr. Christopher, which is well known for his herbal understanding, has a lot of herbal formulas, and also he was a teacher teaching his herbal formulas and the understanding of iridology. So Dr. Christopher looked into Lynn's eye and could see down in the lower part in her leg. He said, "I'm sorry, but there's a very major weakness in the leg and in the circulation moving in your lower back," which later formed the weakness that she had in the chest because of her genetic makeup with her father, which was actually in World War I, not II, one, and he was actually flying over, and as a photographer, because he also was in Hollywood in the 20s and 30s as a photographer, taking pictures of what was happening in those biplanes. At the same time, he got a lot of exposure to chemical at that time. So the genetic makeup and the formation of Lynn's bone marrow from that exposure from her father activated the weaknesses that later she had in her life, which had a direct relationship to her breasts and the liver function with the breast cancer she had when she was, in her early 28. She was 26, I was 28 when I met her. So that situation there at the same time through her experience, that sharing, she shared that understanding of the iridology to Lorraine, and Lorraine's actually just taken that same understanding back, like I said, so many years, and just kept on growing it and growing it and growing it. And we have so much appreciation for Lorraine's expansion from thousands and thousands of irises that she's looked at, and seeing the changes from year to year to year to 220. That experience, and looking at this, which we're sharing with you now, is a makeup, the reason that the relationship of the iridology and the formation of the iridology to the brain and to the cerebral spinal fluid in relationship to the amino acids. And the reason the amino acid formation of the different ways that we utilize them is what allows the body to activate that regeneration, not disease, not a germ theory. It's actually the regeneration of the cells from the amino acids to maintain oxygen and to rebuild our cells back up. Do you want to show those pictures? Right?
Which one are you talking about? Oh, I have to find those.
Okay. All right.
We keep, yeah, I'll find those.
She'll find them. So in that relationship of what we're expressing with the iridology and the actual formation iridology, you can see right around, this is the mapping, right around the center, that's the nerve wreath. That's the marking of the eye. You hear Lorraine said that everyone has a individual marking just like the thumbprint. And
it's called the autonomic nerve wreath. And it's a landmark in everybody's eye. It goes right around. Some people have it close to the pupil, and some people have it further apart from the pupil. So it's also the internal strength of the individual. So when the actual autonomic nerve wreath is further away from the pupil, then the vitality levels aren't as strong, and there's a leakage that's happening within the cerebral spinal flow, depending on where the autonomic nerve wreath is moved out around the pupil. So when it's close to the pupil itself and it's tightly woven close to the pupil, that's the internal strength of the individual. It's also the reserve that the person has, the vital reserve. So you can see a lot from following the autonomic nerve wreath in anybody's eye.
So what Ryan's actually expressing there is that you can see the individual strength. We have, some people have a strong constitution, strong vitality. Other people can have a weak constitution or weak vitality. Now, you can see that in the actual fiber of the eye when the person was conceived, and later the conception and the growth within the womb. The fiber of the eye, when they're very, very straight and very, very strong and very close together, that's actually showing the strong vital energy that came from the mother and the father at the time of conception. Because that's the reason in astrology and everything, they want, your birth chart right when you're born, that time, because that time is when the soul enters the earth plane, and the vibration, the formation of the individual is to all the outer planets and to the inner energy of the time of conception. And then from there, it just forms the whole regeneration of this child in the womb over those 9 months. And then we take our first breath, which is where the astrology starts at that time that we're born. But the actual formation of the energy of the vital force of our strength, of vitality or weakened vitality, then shows up in the eye. And then when we're born, that time period shows up the actual fibers. So when the fibers are actually ballooned in the eye, all around the eye, that's showing a weakened constitution. Now, weakened constitution doesn't mean you can't change that, because you can. Usually people have a weakened constitution, they're more sensitive to foods, environment, like that. And so they take better care of themselves because of that. Where a person with a strong constitution can basically eat what they want, do what they want. They have strong energy. When they're 20, 30, 40, they've really got strong. You reach the 50s, well, that could be a different story, because we lose 50% of our growth hormone at that time. And so that vital energy can start to be lost. At the same time, when a person has a weakened constitution in their 20s and 30s and keeps working themselves, by the time they get to 40, 50, they're stronger, their vital energy is clear, and they have a very long, healthy life. That's called the regeneration from the amino acids and everything a person does. What happens to a lot of people with strong constitution is that they can do what they want, eat what they want, and so on. But the time they reach around, for a male from 25 to 35 or 30, they start to lose 50% growth hormone. So their levels start to show weaknesses. By the time they reach 50, they were showing some major condition like heart disease, prostate problems, and so on, or women with the ovarian problems, or swelling in the breasts, or problems in the bladder, or all these different.
So I'm just going to go to the autonomic nerve roots, just so that so this is what I was sharing, is this goes around everybody's autonomic nerve reef is different. And I'm just drawing around this. We got consent for me to show you this eye, so we're all good here. So you'll see this is the autonomic nerve reef, and it's a landmark in everybody's eye. There's no two autonomic nerve reefs the same, just like there's no two fingerprints the same.
So this is when they see who you are, when they take your picture at the going in, from the eye to see who you are. This is how they can tell the person when they take the eye picture.
So everyone's autonomic nerve reef is different. So we're focusing today without the understanding of inside out to outside in. And so, like I was sharing, when it's closely knitted to the pupil, which we've got sections here where the actual autonomic nerve reef is quite tightly closed to the pupil, where there's certain areas that it's see further away. So this is the internal strength that this person has in their internal part of, which is straight down the center. So straight down the center of the eye is the center of the body. So yes, there's two eyes, but they also make one.
Yeah.
So the strength is internally straight down the center line. So the person's very strong internally in the energy moving up in the core and up and down in the core. And that's what's showing the strength, and just showing you the understanding where you follow the autonomic nerve reef and how it's closely knitted is where the individual has the strength, and where it's further away is where there's less of the strength in that area. But we see the autonomic nerve reef change. And in iridology, because inside the autonomic nerve reef is the colon, the small and the large intestine. So you can also note, by following the autonomic nerve reef, the tone and structure of the individual's colon. So when seeing it change means you're building a new structure, because every organ begins to show improvement.
So when you look at the lower part in this particular area there where it's more ballooned out, further down you can tell that that's a weakened area for her. And that's the area that actually will start to draw up, and that will actually change from month to month as the person's regenerating the colon and regenerating the uterus, in this case a female uterus and cervix, or male will be prostate or testes. So
as Jeff was sharing before about constitutions, to just give you some examples, even though it's cloudy at the top, the lines, these are nerve fibers. So these lines actually run parallel and straight to each other. Where if you look, see how the fibers in the eye are more broken, they're more woven and more broken. So where the lines run more silky and parallel next to each other is where there's strength. Where they open and they balloon out is where the area is weakened. When there's a closed lesion, it means it goes further back in the constitutional makeup, not just our parents. When there's an open lesion, that's maybe 1 or 2 generations. An encapsulated area is a closed lesion, and of course that means it's weakened through many generations. When it's an open lesion, means that it hasn't broken down over a long period of time. It's more 1 or 2 generations back. So that's how you can see the understanding of strengths within the constitution of the iris, as well as weakened areas within the constitutional makeup. There is no perfect eye, so everyone shows something. There is no perfect eye. A lot of people we look at that have very strong fibers that have a silk iris, in our experience, they have a lot of toxin. Because they're strong constitution, they can keep going and they can do things and eat this and eat that, and they don't necessarily fix the things along the way. So they accumulate easily a lot of toxin because they're able to get away with it.
So the question is, what is toxin? Toxin is mold, fungus, virus, chemical, physical trauma or injury they don't recover as well later in life, and then also emotion. So what happens is people that have this situation, they start all of a sudden, their back goes out, or they have a heart problem, or they start becoming very anxious, where they didn't have that before. And what Ray's actually saying about the actual genetic makeup from one grandmother, grandfather, great, that is very significant in that it's showing a lot, why, Cora's question, why is a child that's born has leukemia? Okay, why? That's a chemical breakup of a virus in the blood, which is what leukemia is. And the next question is why did the child live to 2 years of age? Because it was a genetic weakness from the grandparents to the father that was passed on to the mother, which is the toxic blood of the chemical. And so because of that basic understanding, we can see the genetic makeup of us. And then if we can then take care of the genetic weaknesses that we inherited, which you can with amino acids, activate that regeneration. Because everything in life, which we repeat a lot, everything wants to live. Even these parasites and viruses, everything here in the earth plane wants to live. So if we work with that understanding and activate the regeneration, then we can start to heal our great-grandparents that caused us genetic weakness that we are carrying in right now. So really incredible understanding when you can understand that the reason that certain people have certain conditions, or why this child is born with a disease that is, it's terrible, it's awful. It's why did God create the situation for that individual? And the answer to that is that that individual was here to go through this process and then regenerate and heal in the next lifetime.
Now we did a treatment on one of our patients yesterday, and we took a photograph before and we took a photograph after they had the energy balancing. I'm just going to pull the photos up so I can share with you and show you the before and after the treatment. And this is the energy balancing. On the left-hand side is the photo from when we just took before the appointment, and today is, before the analysis and then also after the treatment on the right-hand side. This is the one before the treatment, and this is the one after the treatment. These are the ones we're looking at, right?
Yeah, yeah.
Okay. Or is this the other ones? So you can see the darkness, like what happens is the energy flow increases as the person gets the treatment done. So if you take a look at that big brown spot, and you probably, a lot of you might be saying, well, what are those brown spots? Some of you have had the analysis done before, so you know those brown spots. The little, little lighter scattered ones that we see, they're environmental. They're whatever a person's been exposed to, whether it's medication, environmental toxin, drug related, there's some sort of exposure. Renovating a house, there's some, it's some sort of heavy metals, there's some sort of exposure. When you look at the ones that are bigger and darker and bolder, those are hereditary. They've been passed on through, and obviously again, like I was sharing, when the fibers break, open and close lesions also mean further back in time or 1 or 2 generations back. Also the same with the brown spots in a person's eye, when they're bigger and they're darker, also represents how far back they go in the constitutional makeup. So you'll see this was before the treatment, the energy balancing, and this is after. So you can see that it's got lighter, right? Okay, the actual chemical spot has got lighter than what it was. The eye is not flat, it is 3-dimensional. So there's a layer, and then there's another layer and another layer. So as the energy increases, then a layer peels off, and you're actually going into the eye like craters of the moon. So you actually see the layers. So what's happening just after the treatment, the energy flow increased, moving down into that area being the reproductive area. It's the uterus, it's the bladder, it's the cervix in the female, and the prostate in the males, as well as the lower back, sacrum. Even though in the polarity understanding of the iris, when we look at the eye as polarity, straight down the middle of the pupil, straight from the middle, like cutting an apple, right, in quarters, right, straight down the middle of the pupil is also the spine, as also the umbilicus, meaning that if it's not centered to the colored part of the iris, the pupil, that's the umbilicus, which is the exact center of your body, to the top of your head, to the bottom of your feet. So that is not centered. That means that your sacrum is out. Your sacrum is tilted. Posterior, moving forward, anterior, or it's tilted, right or left. So we also use that as a way of indicating too where the spine and the position of the spine is, with looking at the iris, where the position of our pupil is. So showing straight away after the energy balancing is showing right away that the lightness within that genetic exposure of chemical that's being passed on through the constitutional makeup. And we're talking about 3-4 generations. We're not just talking about parents or grandparents. So that exposure that's being passed on, you can already see from the energy balancing that we gave, the treatment we gave, you can see it's already lightening up. So the layer underneath is, as the layers are peeling off, you're seeing it coming much more to the surface. If you also go to the inside around, because this is why I'm focusing on one area for you right now, inside out. And if you look around the inside, you'll see that all these areas, there's more strands of lighter color of fibers all around the reef, inside the reef. Remember, that's the digestive hub. And I'm going to blow it up so you can see it up magnified. Showing the 2 pupils at the same size. Seeing the showing of the 2 pupils at the same size. And then you'll see what I'm sharing is, see how the strands of fibers, there's more lighter gaps between the strands, the darker gray areas, there's more lighter strands. So that's internally, that's showing the blood flow moving into the intestine, into the colon, and any fungus or mold or bacteria that's in the actual colon cannot live. It's the reason there's a change in the nerve fiber from the pupil, feeding from the nerve fiber from the pupil, the spine, because it's the brain, the nerves from the brain, down the spine, branching out to a different part of the body. And you can see the energy is increased in the nerve fiber from the brain down the spine, branching out, feeding into that organ or gland wherever it's located. So you can see a lot just looking from inside out. So it means that the oxygen levels have increased from the energy flow into the colon, which, remember, cancer, funguses, viruses, mold, bacteria, they can't live in oxygen. They all live in carbon dioxide.
So show the changes there, then.
So this is where I'm showing you up close. See it, you can see the depth of it. You see how dark underneath, like understanding it's a crater of the moon. So you can actually see as the energy increased and the circulation moving down into the reproductive area, the uterus being a muscle, you can see that the darkness underneath, the chemical is lighter as it's going deeper into actually removing the sticky plaque.
Now, the part to understand about plaque, which is the homocysteine, then any toxin can get exposed to that and get stuck to it, and that's what can cause a blockage. So that plaque is being removed, so any toxin was there now can be eliminated out. Again, mold, fungus, virus, and so on. So and that's just from the energy balance. The energy balancing is exactly what it is. The treatment is designed to be able to activate a balanced energy moving from, again, same concept that we're dealing with, from the umbilicus out, from the top of the head to the bottom of the feet, where everything is balanced. The 5-point star, which is the energy moving from the back of the neck, the thyroid, down through to the hip and the ovaries, testes, and then crossing back up. And then that draws the energy of the feminine energy up, just like, activating the circulation, moving to the pituitary and the brain. And then the 6-point star is going from the pituitary down through the center to the sacrum, and that's the core energy of the male energy moving back up, and that's a spiraling of the cerebrospinal fluid. So when those energies are all balanced, when the person actually sits up on the table, they grow. The shoulders are like that balanced. The spine, instead of being like this, starts to go like that. So as that's going, you can now see, this is just showing that energy is life. This is actually showing no nutrients, no amino acids being taken at that time. This is actually showing the energy moving through. The key with amino acids is amino acids holds on to our life energy and activates the life energy in our body on a daily breath, daily, 24 hours, monthly, yearly, in a lifetime. And that's the key. So it shows that when energy flows through, now when you're taking the amino acids and you're doing our program and activating the regeneration, when you do the energy balance, it's going to move even more. It's going to strengthen and regenerate even more. So this is actually, to me, what this shows is that energy is life. When we activate a balanced energy for ourselves in a balanced form, and we, with our program, from month to month, we're constantly, as Lorraine's actually helping you so much, she'll do her best to correspond to you as you go through certain things. And in that, make it say, do this, do that, just a little change, and that will balance energy. And then the regeneration, that toxin can be removed, and then you activate a new cells, new body, and we're removing all this environmental toxin. Same time, removing the genetic toxin we inherited, and that moves out too. And that's the process of life.
So for the charts that we sent you, if anyone wants their photos sent to them, I can more than happy send you photos. If you put the left eye, which is done, left eye up next to the chart, and then also your left eye next to each other, it's actually simple. Because the small intestine's on the inside and the large intestine's on the outside, and anything to the top of the eye is the head. And then, of course, what Jeff was sharing about the spiraling, go straight down the center. So you can actually see, just putting the chart next to your eye, you can actually see specifically where the areas. You can see that this is, even though we've got yellow here, that this area doesn't have a lot of breakage in the fibers. It's more breakage through the, like a clock, which is what I share with people looking at it as a time clock. There's more breakage from, say, 8 around to 9.5. There's a few gaps in certain areas in between, but there's a lot more gaps and a lot more of the fibers breaking from 8 to 9.5. So that's where the area, being the left eye being our constitutional makeup, how we read it in our DNA with our mum, and then our right eye and how we read it is our genetic gene pool to our paternal side of the constitutional makeup. Just like energy, outgoing, right side, outgoing energy, female receptor side, left side. Now, of course, we have, the heart more to the left, but it's also central. Our major organ on our right side is our liver, but it also does represent in both eyes too, because we're a whole person, even though we're dealing with left side of the body, right side of the body. So this is actually a simple way to see, you just put that little easy chart, because you can get stuck in the little areas like the master chart. The master chart has very detailed areas in the iris. You can get really stuck in those areas and, get stuck in the details. We're wanting to teach the overview and give you the basic understanding of it, and then go to where in your eye what stands out. And then look at that area, what stands out, because it works with the whole system. So if you look at your eye and you go, wow, you will just visual that photograph and go to yourself, what stands out first, right as soon as you look at it, whether it's the yellow, whether it's the shape around the middle, whether it's the outer part of the eye, whatever it is, just take a visual map and look at the chart next to it. And then that gives you a corresponding reflex to that area and the area that needs to be balanced. So you can't analyze it incorrectly, because you're going to what stands out at you first, and it all works together. So if the yellow stands out for you as soon as you look at a person's eye, then that yellow is the sugar that binds to estrogen, which we all are bombarded by now. It's a reason now, working with young children that we work with now, we are seeing, particularly now, with the amount of estrogen that we're all being bombarded by, young girls getting their menstrual flows very, very early. I'm talking the age of 9, 10 now. And so that's the estrogen that's actually bringing on the cycles a lot earlier now than ever before.
And the reason for that is quite simple. That mother before was absorbing the sugar and the chemical, and then conceived, had the baby. The baby then also has been exposed to that with the chemical and sugar, because more and more chemical we're exposed to. So that's showing the estrogen for the female brings on the hormone production. So that's the reason that a young woman now is not 13, 14, is now 8, 9, 10. Isn't that something?
So you can't analyze it incorrectly. Whatever stands out with the iris that you see first, and you just use that simple chart that we put together, and you just correspond it. If you look and you see at 9 o'clock, right, and you'll look at the chart and it shows small intestine, and it's the nerves, because of where those fibers come out, they squiggle, right? Well, you know that that's the small intestine. There's an absorption weakness, because the small intestine is where we assimilate our nutrients. Plus there's also yellow, which means there's more sucrose, more carbon dioxide, and more estrogen, which, carbon dioxide is what plants live off. We need oxygen. So that's, gives you a confidence. You can't make a mistake. Nobody can make a mistake with the eye, because it's whatever stands out when you look at the eye, that's the area that you want to look at.
The other quick thing comes is that, well, that young woman that now is not activating a natural cycle, her period's coming at 13, 14, 12, 13, 14, now it's coming from 8, 9, 10, maybe 11. What can you do? Because that's all, chemical toxin mimicking natural estrogen. So you can help that young woman at 8, 9 to remove that excess estrogen, and that keeps us from getting reabsorbed, and actually can help the whole constitution of that individual. That's a beautiful part of our work, that we can help that situation, even though that's occurred.
Does anybody have any questions, unless you have anything else to?
No, it's all good.
Does anyone have any questions at all? We'll take questions and answers now from anyone.